Imagine you walk into an emergency room anticipating being seen by a doctor. You're seated, and then a medical provider walks into the room who introduces themselves as a physician's assistant. This is an occurrence that is becoming far more common in today's medical facilities. In 1650, Peter the Great introduced German military Feldshaers to the Russian military to help provide their need for medical care. In 1898, the U.S. Navy developed the Hospital Corps to train corpsmen to treat the Marines and naval personnel overseas. In 1930, the U.S. Public Health Service developed a program that enabled these returning corpsmen to treat inmates at the federal prison system. There were several things in the 1940s that led to the development of the physician's assistant position. First off, Indian Affairs, to address the needs of the Alaska Native rural populations, developed a position called a community health aide to take care of the patients under the supervision of a doctor. Because of the increased need of medical providers during World War II, Dr. Eugene Steed developed a fast-track program that only required 3 years to complete medical school. This program, as well as Eugene Steed, would become critical later on in the development of the physician's assistant. In 1961, the House of Delegates called for a mid-level provider to be established to meet increased needs for medical care in the United States.
In 1965, Dr. Eugene Steed launched the first official PA program at Duke University. Of the 4 individuals who entered the program, only 3 graduates emerged 2 years later, all of which were previous military corpsmen. Later on, in 1969, the MEDEX program was launched by Dr. Richard Smith. The primary goal of this program was to provide medical care in rural areas, as this is where healthcare shortages were at their most severe. Later on, in 1971, to further increase the expansion of the PA program, the Comprehensive Health Manpower Training Act authorized federal funding for physician assistant education and deployment. By 1980s, there was a cumulative 42 PA programs in the US, producing over 9,000 PAs. By 2000, the number of PA programs in the US had increased to 114 programs, producing over 45,000 practicing PA providers. Fast forwarding to 2010, the Affordable Care Act was passed. This further exacerbated the need for practicing PAs, as many more people now were insured and the healthcare shortage burden increased even